Texas. And as our communities expand, so does the need for good health care. But as the need grows, some hospitals in Texas are at risk of closure. A new report shows 1 in 10 Texas hospitals could be at risk, especially those in rural communities. KVUE's Ford Sanders looked into what this means moving forward.
Construction, billion-dollar expansions, all making way for new hospitals.
We know in an area like Central Texas, we are experiencing significant growth.
But how is this possible when a new report from Kaufman Hall shows 1 in 10 Texas hospitals are at risk of closure?
The biggest challenge is the workforce piece, and so that's the increased cost of labor, the shortages in labor are really creating access challenges for hospitals being able to keep services open and creating fiscal challenges as labor costs rise.
John Hawkins is the president and CEO of the Texas Hospital Association.
We are the statewide trade association for hospitals in Texas. We have more than 600 member hospitals.
He says nursing shortages are just one of the issues impacting hospitals.
We had a nursing shortage before the pandemic. We were turning away about 15,000 qualified nursing students every year because we just didn't have the capacity in our institutions to train those folks.
That very shortage bringing on safety concerns for Central Texas nurses.
Hey, hey, ho, ho, this corporate greed has got to go.
Nurses gathered in late January outside of Ascension Seton's offices in Austin, demanding safer working conditions.
We have a lot of morale fatigue from different areas, and I feel like right now we're focusing on that being unable to get the point across that safe staffing needs to be mandated.
Christine Kittleson is a nurse with Ascension Seton Medical Center in Austin. She says staffing shortages put patients at risk.
We're having really high nurse-to-patient ratios, and it's just leaving room for us to make errors that could be preventable and not giving our patients the care that they deserve.
We've seen the stories about burnout, about folks taking early retirement, just not being able to deal with that continued challenge from the pandemic.
The Kaufman Hall report states almost half of all Texas hospitals are operating in the red, losing money, partly due to labor expenses. In 2020, these expenses across Texas hospitals sat around $5 billion higher than pre-pandemic costs. In 2021, they rose to $16.4 billion, with last year costing hospitals around $18.1 billion more collectively than what it cost before COVID.
Expenses have just exploded, and that we tell people that our hospitals limped into the pandemic. They've survived, thankfully, but they're going to limp out of the pandemic.
John Henderson is the president and CEO for TORCH, the Texas Organization of Rural and Community Hospitals. He says these problems and risks for closure are even worse in rural communities.
We know rural hospitals have a 26% risk of closure. That's 1 in 4. Does that surprise you, or has this been an accumulation of things that we know need to be dealt with?
It doesn't surprise me. Actually, we view the report as affirmation of what, or confirmation of what our members have been feeling, which is increasing vulnerability and pressure on their survival.
Kaufman Hall's report attributes some of these issues in rural hospitals to operating margin concerns, total costs for supplies, declines in patient volumes, and more.
We call it death by 1,000 paper cuts, so it's not one thing.
Texas, unfortunately, led the nation in the number of rural hospital closures before the pandemic. So we knew we had challenges in rural Texas before the pandemic. The pandemic has made that worse.
Both say if hospitals have to close, well, these consequences could be deadly. It nearly was for Thorndale resident David Persons.
Jennifer looked over at me, my wife, she was driving, thank goodness, and I wasn't breathing, I wasn't doing anything. I was just sitting there turning blue.
He was suffering from symptoms similar to a heart attack and only had minutes to get help.
I wouldn't have, I'd have been dead. I mean, they told me if it had taken more than 10, 15 minutes, no way. Apparently it looked really bad for a while because they were talking about even if they saved me, I probably wasn't going to be much of, have a brain function or anything.
He notes smaller community and rural hospitals like Baylor Scott and White Medical Center and Taylor were his saving grace, so he wants them to thrive well into the future.
What happens when my son has that heart attack in 40 or 50 years or whenever? Will the same resources be there that were there to save me?
These hospitals are also critically important to the economies of communities around them.
The hospital is usually one of the largest employers in those communities, and so that has a ripple effect for restaurants, other businesses, other vendors in that community as well.
For these reasons, Hawkins and Henderson and other hospital advocates are asking the legislature for help. They say they lobby at the Capitol and have met with the governor in person to highlight the need.
The base bill in both the House and Senate have significant investments, additional investments in the workforce pipeline, and we hope to build on what's in that base bill going forward.
Those bills are House Bill 901, sponsored by State Representative Stephanie Click, and Senate Bill 244, proposed by State Senator Lois Kolkhorst. Both bills focus on things like post-secondary education for nurses, as well as loan repayment assistance and more.
You got a surplus this year also in the budget. You've got money to be allocated. What do you really want to see come out of that? That the legislature has to play a big role, right, when it comes to sending out this money.
We'll ask for continuation of what they've already done, but then we're going to ask for more as it relates to workforce, physician and nurse loan repayment programs to try to attract those professionals to live and work and serve in rural communities.
All saying it's now their mission to work closely with the legislature to prioritize the needs of all Texas hospitals. In Austin, for KVUE News, I'm Ford Sanders.